Dr. Amanda Chase, thank you so much for coming out and speaking at the 2019 GOMA Fall Conference. You did a great job talking about dealing with a difficult patient.
Thank you.
Tell everyone what you do. What are you doing right now as a professionally, I guess I should say?
All right, right now, as of last year, I just started a new job as an assistant professor of psychology at Middle Georgia State University on the Cochran campus. We have 5 campuses, and I'm on the Cochran campus, which of course is the best, but no. But so I'm teaching intro to psychology, intro to human development, psychology internship. Next semester, I'll be starting with abnormal psychology and online capstone, which is a research writing course.
Cool.
So it's fun. Keeps me busy.
I know you're doing a great job because everyone loved your lecture.
Thank you. I appreciate that.
And so you talked about this during your lecture, but I'm going to ask you to repeat a little bit about it. The patient who is not following through with a treatment plan, we call it non-compliant, though you actually used other terminology. What are some strategies that we might want to utilize in those kind of situations?
The non-compliant patient, a lot of times, I mean, there's several reasons that they could be non-compliant. Life stress, or they don't understand the treatment plan, they don't understand the severity of their situation. And it's just really getting them to take responsibility back for that. So it's asking them, when we talked about the technique in there, the miracle question. I love this question. It's asking them, if you were to wake up tomorrow and your problem was resolved, if you felt better, what would that look like? And then, they give you answers. I'd lose weight, my diabetes would be under control, I would feel better, whatever it might be. They give you that answer. And what they've done is given you their goals, their priority list. It's like, this is why I'm really here. This is what's important to me. So you incorporate that into the treatment plan. You say, okay, great. How can we make that happen? And then you both start brainstorming goals together to make that happen. Because now they're invested in it. They're invested in that treatment plan. And they'll tend to value it more because they feel like they've had a part in that. So it's getting them to take that responsibility for that.
The other method you used, you talked about the foot in the door method.
Yes, I love the term.
Why don't you summarize that, if you don't mind?
So foot in the door is, you have a big request or a big goal you want them to get to, but it might be a little overwhelming. So you start with a small request first. So if you can get them saying yes to something smaller, like, hey, you might need to quit smoking, but instead of saying go cold turkey, you might say, hey, can you cut down a few cigarettes a day, or cut down a few packs a week, and slowly work up to that point of quitting smoking, or taking a medication, or seeing a specialist, whatever it might be, whatever you might need them to do.
Stroke their ego as they make progress. That's great.
Yes.
I'm so proud of you. Can we get it down to 3? Can we do stuff like that?
Exactly.
And then the last sort of method that, as I recall, because I was paying attention, even though I was looking at my iPhone a little bit, is the door in the face method.
This one's one I just recently learned about.
Yeah,
so
tell everyone about what that door in the face method is.
Yeah, I like the visual image you get,
Sure.
but so basically it's the opposite of the foot in the door. So instead of starting with a small request, you might start with really large requests, and you might hit them with a lot of things. You might have one thing you want them to do, which is quit the smoking or take a certain medication. You have one thing you really want them to do, but they might not do it, and so you hit them with a lot of, hey, you need to lose the weight, exercise, quit the smoking, do this, do that, and you hit them with a lot of information, and then when they come back and say, that's too overwhelming, I can't do it, you say, okay, let's start small. Let's try this, and it's usually the technique you want them to do first. And it seems less complicated, it seems easier, so they'll be more likely to say yes. So I've created a classroom of therapists and monsters.
No, you did so great, and then you had strategies for all these different things that we deal with every day, and we just want to take you, put it in our back pocket, and suck your brains out or something.
Oh, thank you. I had fun.
Yeah, well, we appreciate it. Thank you once again.
Thank you.